Hang on. I just
All
picked
right.
up some.
Welcome, everybody, to tonight's Board of Health meeting. It is April 29th, 2026. I'll have everybody rise, please, for the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. All right, and we'll jump right in with our discussion and action items. We have a very special guest this evening, Jacinia Uria from the Mass Public Health Shared Services Coordinator position of Plymouth Norfolk County is here, and she's going to discuss with us Abington's future participation in the Public Health Excellence Grant and SAFE 2.0. Jacinia, come on up.
Yeah.
Yes, and we put you right at the beginning, so that way if you didn't want
Welcome,
to
Jacinia.
sit through the later factors, you didn't have to.
I appreciate that. Thank you so much. So my name is Jacinia Uria, and I am the Shared Services Coordinator for the Plymouth Norfolk 5. I've had the pleasure of working with Chris closely and getting Abington up to speed. So the Shared Services arrangement is a group that was formed under the Public Health Excellence Grant. And so the purpose of the Public Health Excellence Grant is to assist Massachusetts municipalities in rising to meet national standards. So I'll give a little bit of overview for the board, and also for anyone watching who needs to know or wants to learn a little bit more about what's going on in public health in Massachusetts. And so in 2016, then Governor Charles Baker filed a resolve to form a commission called the Special Commission on Local and Regional Public Health to study the state of local public health in Massachusetts. The report was published in June 2019 and is titled Blueprint for Public Health Excellence. It's available on the DPH website for those interested in reading the whole report. So over the span of 2 years, the 25-member commission went over official public records, engaged stakeholders across the state, and found generally that Massachusetts' local public health system, as currently configured, largely does not meet existing statutory and regulatory requirements. And I should say that from the quote starting local public health system up to requirements is lifted directly from the report. So why is that? So Massachusetts public health system is pretty unique in the nation. There are 351 municipalities, and each municipality has their own health department. The municipalities and the Board of Health, as you all are part of one, they're able to enter groups and shared arrangements. But at the base level, each municipality is tasked under Mass General Law, Chapter 111, to carry out public health functions for every municipal resident. It's difficult. There are budget constraints, but there's a job to do for everyone on a Board of Health for every municipality. I know Chris is leaving. He has resigned. But he's taking with him years of experience, credentials, and relationships that he has leveraged to keep Abington healthy. The plan for replacing Chris should be clear, transparent, and timely. Abington needs a health agent, and, I understand that there is plans for a volunteer to help answer the phone and everything, but also Abington's just going to need someone who's going to do the food inspections, the housing inspections, take care of trash and compost. I think those are duties that maybe can be taken for granted in a modern society, but those are really the fundamental levels of public health. Keeping a community clean, free of pests, free of nuisance, and with the passage of SAFE 2.0 in 2024, which was a bill passed to help modernize the Massachusetts public health system, DPH established minimum qualifications for municipal health department employees before municipalities could hire anyone they would want, just to give a chance to people to help employ them in the health department, right? Train them on the job. But that's shifted since it was noticed through the report that many people just didn't have an understanding of their duties of public health. So it is extremely important to make sure that boards of health are hiring health agents who are credentialed, who have the experience, and who have the ability to build relationships in a community. Employees work to carry out the Board of Health's responsibilities, and without a replacement, the board faces challenges in maintaining adequate public health responsibilities. And, a working public health department in Abington and beyond does more than nuisance complaints. A working public health department performs disease surveillance, conducts case management of serious infectious diseases. There has been questions about the fact that Abington has lost a public health nurse, and so how is disease surveillance being conducted? And I can say that Chris has helped out a lot with that. He's been tasked with Maven. But quite honestly, DPH would like to see a public health nurse or EPI do those cases follow-ups. I helped out while he was training on to get onto Maven. And Katie, you're a nurse, correct?
Yes.
So when I tell you, when I had to do the follow-up for foodborne illness and they were asking me what were the test results, I'm just like, they were sick. And that's it.
Yes.
But you need more information. Absolutely. So public health is more than just, hearings, getting people in trouble. Sometimes that can be the public perception, or just taking fees for like an inspection. Like, those inspections are done by trained professionals. They're making sure, right, that there's no mold in houses. They're making sure that trash is being properly contained. They're making sure that food is being held at safe temperatures. The invisible network that exists in every municipality can just be thought of as, oh, that's just how life is. But there's work being done. There's work being done by this board here and across other municipalities. And of course, health agents like Chris, honestly, just do a large amount of work that sometimes they aren't recognized for or even paid adequately for, if I might say. There's so much going on in this area alone. We have to face the truth of climate change, for example, with droughts, severe storms coming in, winter storms, heat emergencies, the FIFA World Cup. People are going to be coming in and out of Abington for those events.
Emergency preparedness. I don't want to jump in, but
No,
Chris
please.
spearheaded having a warming center for us over the winter on multiple occasions, and I feel like bravo, Chris, it went unnoticed. Didn't go unnoticed.
Exactly. So those kinds of functions are under Board of Health responsibilities. And, I think to the person, especially me, right, someone who has a house, access to a warm house in the winter, it's like, okay, who's going to use it? But we don't think of people who might not afford heating bills, right? People who are unhoused, people who just came new to the country, even the area from another state, right? And haven't established any type of credit, and heating is expensive now, right? So just all those things, and that's all I wanted to say today. And just get to know everyone on the board. And I'm a resource here. I am the shared services coordinator. I'm not a health agent, but hopefully I can help everyone get used to a new reality.
And give us guidance.
Yeah,
Because
hopefully.
I would like to go on record as saying I'm very concerned. I think a lot of the next couple of months, any grievances that get reported, they're going to come to us. And because we don't have a health department, and a lot of them, I know we're all volunteers who are in non-paid positions, and I certainly don't have a lot of the qualifications needed to go out and do these inspections, nor should I. And so I'm just...
The food inspections, they're covered, though. That company, Osco, is coming back, isn't it? I mean, they've already done some.
That's dependent on how things play out. Yes, currently they are doing our larger
Okay, 'cause
restaurants
I
for
mean,
us. Yeah.
I know they have.
Yeah.
Yeah.
Yeah,
So,
we're utilizing them now
So we're
as-
covered there, and they've done them when
Yes.
Marty was here, and they did them before, for a time that you were here, too.
Yeah.
And, so we're covered there.
Yeah,
I just don't want the people that go to restaurants to freak
Sit-
out about an Abington restaurant. Abington restaurants have been inspected, and they are safe, and we
Yeah.
do have something in place.
We do. Yeah.
We're utilizing them through our shared services group, so as long as we're a part of that group, we can continue to use them, but we do not have a budget for inspectors, just to be clear.
I think budget's a big thing, not just this department right now.
Yeah.
And it's a big variable at this very moment.
Can you say
So
again who's
just,
doing the inspections?
It's ALSCO, ALSCO. They're a food inspection company.
Okay, thank you.
So just to backtrack a little and then have some good understanding. So yes, that's fabulous news. But in order for us to maintain our position as part of the program, we need to have an acting health agent. What is the leniency there? So our town manager has put out that he hopes to have the position filled as of July, but that's a couple months away. And so what does that mean for us?
So the official position of DPH and OLRH, which is the Office of Local and Regional Health, is that the Public Health Excellence Grant funds, are meant to increase capacity, enhance services, not maintain or supplant. So understandably, Abington is feeling a huge budget crunch, huge, as well as other municipalities. But I would say like the first step in order to maintain participation in the Public Health Excellence Grant is to at least find a public health nurse who can help with MAVEN coverage. That's a big one. Or also to find a health agent to help with the inspections. So ALSCO, while it is being paid out of the Public Health Excellence Grant as contractors, that won't be a sustainable long-term plan. Actually, we're going to have a Plymouth Norfolk 5 board meeting tomorrow. I invite you all to attend. I could share the link. It's in the morning. But that's something we're going to be talking about, Chris, is the budget for FY27. And
Sweet.
it's already in the budget for that. It's tight as well. So I would say that it's really important for Abington leadership to have that in mind, that they need someone, like not a want, it's a need for a public health nurse and a health agent, just because there have been cases in Abington that required a public health nurse to do follow-up for a sustained amount of time. So if not employed by the municipality, have an agreement with a neighboring municipality, like an official agreement, definitely.
How difficult if management is not able to secure us a new health agent within a practical time frame, how difficult will it be for us to rejoin once we do have one again? Like, if we get the boot, how quickly are we going to be able to rejoin?
I think the goal is not to boot out or punish Abington. Understandably, the budget crunch is real, as I've mentioned before, and there's understanding. But again, under Mass General Law, Chapter 111, the municipality is to have a functioning health department with the ability to perform inspections. As Chris mentioned, ALSCO is an outside agency, but, you know, they might not be available essentially, right? Because they don't belong to the municipality, they're contractors. So if you have anything emergent happening, for example, I can just think of an example where there's a fire and gas needs to be turned off or something like that, you know, who's going to respond to that, right? Or there's like an illegal or hazardous dumping situation. And dumping is widespread on the South Shore. Trash, I know probably people are tired of talking about trash and compost and recycling, but it is a challenge and it is truly becoming difficult.
Yeah.
So those are little things that need to be kept in mind.
We need a health agent to help manage that.
Exactly.
Yes.
Absolutely.
For sure.
Yeah.
Yeah.
Is there a way to get this to the town manager? Because he's the person that would do the hiring. We don't do any of
It's
that.
been made aware.
Good.
Yes, so
good.
we have next steps to speak with him, definitely. I just also want the board to be aware that, you know, this is happening, you know,
Yeah.
that there is a plan to talk with the town manager.
Good.
Yes, and so as much as I know that there is limitations on your power, exactly, we want to make sure that the town manager knows, you know,
Per law.
per law, this is a law.
I mean,
Yeah.
frankly, I wish we had the power. It would
Easier.
I don't want the power. I don't want the power.
Well, I mean, it just would make life go
Yeah.
faster, that's for sure.
So Jasenia, thank you so much. I appreciate your talking about this shift in the workplace standards and what we should expect in our next health agent. And I'm hoping too that we're that the board is part of the decision-making process, and that we can be sure that whoever does get hired in a timely manner, if the process is transparent, and that we are definitely involved in the decision-making. Because those credentials, that experience, it took you
The good
like, a
rapport
good
that
10
you
minutes to get it done,
establish.
right?
Yeah, you're gonna have very big shoes to fill.
Yeah, and I also appreciate you
10 and
bringing
a half.
up the impact of climate change. It's kind of, we don't think about it, but when we have these extreme storms, that's when we really see the need for health and emergency
Services,
responses.
Well-
So, so thank you very much for kind of bringing this out for the whole board to hear at once, and to have it for people who are watching and sitting in the audience to know how important this is.
We definitely need more awareness. Sorry to jump in there, Carol. I know a lot of the other departments are in the spotlight right now because they're gonna be on the agenda for overrides, but it's too bad that we need to make this more public knowledge
Yeah.
and where we are, because I feel like when the department was shut down, it was quietly done, and I want to make everyone,
Aware.
yes.
Aware, yeah,
Yeah.
definitely.
And we have
Definitely.
no public health nurse that we, as of Friday afternoon at 12:30, we don't have a health agent, and.
We don't have a health department.
We don't have a health department, and,
Yeah.
it's a problem.
There's definitely steps being taken. Just want to assure the public there are steps being taken to safeguard Abington's health and safety. That will never be left just to the board to do alone, or just the town manager to do alone, because at the end of the day, public health is a group project, you know?
Right.
We all have to put in our efforts and work together, because health knows no boundaries, right? Disease knows no boundaries, knows no ethnicity, no income level, no sexuality. It's going to affect all of us at some point. You know, I think I read somewhere that, right, like most people, like example, disability is not an if, it's a when, right? So how do we think about that and shaping the future of every municipality in Massachusetts?
Sure. So, not only just reacting to situations, but also planning ahead, being proactive.
Absolutely.
The word prevention is that word in public health that gets, that nobody pays attention to, because when it's done well, nobody knows it, right?
Absolutely.
And thank you for saying that public health is also a group process, and we in Abington need to work as a community on a number of things, but health definitely is on the top of our agenda.
Can I ask you about the group situation, the Plymouth 5?
Yeah.
If a situation does come up that seems pretty urgent, or a storm or something, I don't know, can't think of a good example, but how do we contact that group?
Yes, that's a good question. So I would say I would start with reaching out to either the commission, so Brockton is the lead vendor, I should say.
Yeah.
And so the Health and Human Services Commissioner, Wadeja McCullough, she's able to be reached, and, you know, that would be more of a, unfortunately, like a upper level decision, but
Yeah.
you could reach out to her as the board.
What was the name?
Wadeja McCullough, and I could share her contact information. And we also have the director of the health department, Dr. Eno Mondesier, and you could talk to him to figure out, you know, how to communicate with the group. And I know that that Abington also has relationships with the other PN5 members, like Avon or Whitman, and so.
Right.
Yeah, so we can always reach out and make sure that there is something, like
Guidance.
a guidance or response, absolutely. And then I'm also in the role, and I have some access to DPH folks, and there's also the Medical Reserve Corps. There's always a Medical Reserve Corps,
Yeah.
MEMA. So,
Yes.
you know, there's options there, but it can get, we just want to make sure, proactive. So those are some resources. So there are, like I said, there's resources in place.
Can you tell me what region we are in? Because I'm having a hard time. Are we in Region 2? We used to be in, I think it was HMCC 5 or something like that. What,
I forget what number it is. but
Is
I
it- are
remember-
we with
We're
Brockton?
we're 5C.
5C,
Yep.
thanks.
Yes, that was something
'Cause
that
I-
Chris and I had to figure out earlier in the year.
Yeah.
Right.
Yeah.
I was just having a hard time reaching out to the right ones, because I wanted to know if there was anything more current. those
Yeah,
certifications?
did you get my email? I sent you, I think, Tim Blanchard's
I don't
info.
always get them. I'm wicked sorry I
Okay.
did not.
All right,
And
I'll-
that's why I was asking.
No worries.
But, so, we are part of shared services with Avon.
Whitman, Stoughton, and Brockton, yes.
Thank you.
Yes.
Because that's changed over the years. It used to be Holbrook, Avon, Abington, Randolph, Rockland.
There was some shifting in the groups. I joined 2024, so I don't have historical knowledge, but
Okay.
that's who's stuck with the Plymouth Norfolk 5, those 5.
Yeah, and that's the shared services group, not the 5C. That's two different things.
Okay, that's,
Oh, that's a different.
Yeah,
oh.
And
yeah,
that's-
5C, we still got Randolph, Holbrook. It's a bigger chunk.
so the shared services, that's more like the MRC. That is that?
No, the MRC would be under the FEP. That's the Region 5C. There's a lot of acronyms. Yeah.
Oh, yeah.
I know. Well,
I listen, I have charts in my office because I have to remember what they stand
I know, it's
for.
just like, it almost makes more sense to, can we just say it? Because I said something about the NRA and I almost got shot myself. But I was talking about the Restaurant Association.
Yeah.
Well, yeah, I know that there's
Thank
been some
you.
really
Yeah,
nice.
I'll send you a separate email with all that info.
Nice PN5 successes over the past year or so, but we still have challenges ahead, particularly for the next budget cycle. So it's good to know we have all these contacts that can answer our questions and be there in case we need you. Thank you so much for
Thank you.
coming
No
over.
worries. And, I'll share my contact information. I'll leave some business cards before I go, but it was a pleasure to meet everyone. And I hope,
Lovely to meet you too.
yeah, so I'm here,
Thank you.
I'll try to help as much as I can. Thank you. All right.
Lovely.
Safe
Thank you,
journey.
Virginia.
Thank you so much.
Awesome. That was fabulous. We're going to move on to discussion action item number 2, which is reorganization of the board, and I am going to let Chris be in charge of that.
Get around the meeting. I want to take emergency powers and declare myself emperor of the health. Okay, so I'm taking over for the purpose of reorganization. I will accept a nomination for the position of chair, if anyone wants to make a nomination.
I would like to nominate Katie Van Nest for the position of chair.
Okay, I have a nomination. Do I have a second?
I would like to second that.
Okay, I have a second. Any other votes or nominations before we, any discussion?
We're going to do one at a time.
Yeah, might as well. Seeing as none, all in favor of Katie Van Nest as chair, say aye.
Aye.
All opposed? That's unanimous.
Congratulations.
Thanks, guys. Thank you so much.
Would you like me to turn it back over to you for the vice chair vote, or you want me to do that while I'm here?
Keep going.
Okay.
Thank you so
So
much.
at this time, I'll accept nominations for the position of vice chair.
I would like to nominate Carol Dolan for the position of vice chair.
Okay, we have a nomination for Carol. Do I have a second?
I'll second it.
Okay. Any other nominations? All right, I have a nomination and a second for Carol. All in favor?
Aye.
Aye.
All opposed? It's unanimous. Congratulations. And I'll hand it over to our chair.
We're going to do one more, right? I would like to make another nomination
Okay.
for the secretary position, please. And I would like to nominate Lisa Raymond. Sorry. Last name is important.
I'll second that.
Thank you. All in favor?
Aye.
Aye.
Any opposed? Unanimous once again. Thank you so much, Lisa. I am excited about not taking the minutes anymore. But I will take over management of the agenda. So there's a small
Well done.
prize. Yay. Okay. So reorg is complete. We will move on to number 3, which is discussion regarding the proposed regulation prohibiting the manufacture, sale, and distribution of kratom products, synthetically derived cannabinoids, and unregulated novel intoxicants. Our public hearing is scheduled for May 13th. A draft model was sent to town council for review, but it was the Northampton version that didn't include the secondary products, the synthetically derived cannabinoids and unregulated novel intoxicants that we had previously discussed and felt were important. So we would like to use the Canton, No, I thought Canton was the one that has them. Oh, I spoke incorrectly then.
It's the other way around.
The
Canton-
Northampton.
The Northampton one is the model that we would like to adapt.
Yeah, just to clarify, Canton's was kratom only, and Northampton had originally passed just kratom and then realized that, I think the Director of Health and Human Services in Northampton referred to it as the whack-a-mole problem, that other products come up, and you'd have to like do another regulation when the other products came up,
So we
so.
want to keep it all under the
Yeah,
umbrella.
so they developed
Yep.
the kind of overarching sale, manufacture, distribution of all the things. And that's really the one we are talking about, and that we're holding the public hearing about on May 13th.
Right. So I saw that that town council had marked up the version that they sent back, but I would motion that we wait until we get the proper version back. We can all review those prior to the public hearing, and then we can kind of discuss after the public hearing is held at that meeting.
Oh, yeah.
Is everybody good with that?
Yes. Is it a problem to send it back to?
Already sent.
Oh, great.
Yeah, and I asked him to have it for you before the 13th, so.
Thank you, yeah.
And
Before would
to
be
email
awesome.
you.
I know, I was CC'd, I saw. Thank you very much. So once that does come back, I will take ownership of the assignment of redistributing it to all board members in a timely fashion, so that way we will have an opportunity to review prior to the meeting, and that way everyone can bring their comments and we can go over them together, as opposed to kind of like reading through the entire thing at nausea during the meeting. Is that okay?
So we're not delaying the public hearing, though? We're
No.
keeping it still?
I think we should keep it, it's already in place.
Yeah,
Yeah.
and
And how
you
do
probably
we-
aren't voting at that anyway, right, so.
Just getting comments?
Just getting comments.
And how does that get posted? Just, because I'm new and.
I think it's already done, right? It's already been
Well, how-
publicized?
In moving forward, how does anything get posted for a public hearing? I guess is my question.
Hopefully the new health agent will be hired and be able to assist.
Yeah, so as far as our social media, I can put posts out to 3 weeks. I can schedule them, so I can pop up a public hearing notice on Facebook. I think
Is
it's.
that our traditional as Facebook?
We use that, I think it also, public hearings are not required to be in the newspaper by law. Once you pass a regulation, that has to be published in a newspaper. And I would actually probably check with Nancy Hurst on that. I know we just did that for the trash RFP. They contacted the Enterprise to have it published, so.
But what Chris has done is to contact the retailers for these products that are aware of this hearing and
Yeah.
this upcoming regulation, right? And there are how many?
24 currently.
24 retailers.
Hopefully someone will come.
Yeah. And if no one comes, we can
Move forward.
move forward.
I have a question about one term in here, and I don't know if it's going to open a bag of worms or whatever, but I just feel like I just need to ask.
Go.
On the Northampton one,
Mhm.
that mentions right at the beginning, statement of purpose,
So it's the one that did not get sent to town council, correct?
correct?
Okay.
But
Where-
maybe you don't even know the answer to this, but when it's listing to include but not limit to synthetic derived cannabinoids, doesn't the state already have a very stringent way of regulating cannabis and all the synthetic products that it also produces? And do we really want to muck this up with things that are already stringently regulated by the state?
State regulates marijuana, that's it.
So these
Cannabinoids are also in
synthetically derived
CBD and
cannabinoids.
other products, or if it's synthetically, that's your omega-8, your delta-7s, all
Okay.
that stuff, so.
Because I did try searching for it, and there was an area where it said it does include synthetic products of cannabinoids. Not
So
that
this is
Google is
separate
always
then.
right.
My understanding, so this is separate, and I would want it to be still included in this, so that way we're getting a better coverage. And it sounds like it's separate from the regulations that are already in place.
So
The cannabis.
we're clear that it doesn't cover synthetic cannabinoids already in the state?
Yeah, you'd be covering the other stuff, like it's usually the delta-7s, delta-8, delta-9, I think they're up to now. And that's a.
The state
they're-
doesn't cover any of that?
No, those,
Okay.
those are unregulated.
All right.
They're
That's
unregulated at the
important.
state level and at the federal level, so we're starting.
At the local level.
At the
I
local
like it.
level.
Until hopefully it becomes a state.
And, yeah, more and more towns
I
are
love that
getting on
we're-
board.
Yeah, I love that we're future forward.
Yep.
Advancement.
Yes.
Okay, so I think that concludes item number 3. We will just tally ho with the public hearing on the 13th, and then get a little nitty gritty at that meeting. Action item number 4 is the discussion regarding the proposed regulation for the registration of livestock, which has been ongoing. We have a copy here of our most updated draft, as well as the registration form that Carol magnificently took the time to create. Does anybody have any comments on that? I kind of feel like we might be ready to push forward and approve it. But you know what I'm realizing? I don't think it says a vote on the agenda.
No, it says discuss.
Oh, that's unfortunate.
Which I still can discuss one thing.
Sure.
Under, where am I? Page 3, I guess. There's B, C, and D. And D, I don't know if we came to a consensus about whether to remove that or not. So it says all livestock shall be confined within enclosures sufficient to prevent escape nuisance. There was a suggestion at our last meeting, April 8th, to remove it, that it wasn't necessary, but I don't know if we finished deciding that.
I can't remember that part of the conversation. I might need to go back and review. Does anyone recall? Was that a recommendation from Joe Kenny?
From Aaron saying that it probably is going to get looked at if there are any new complaints or anything, but that it was so hard to define what we wanted that to be, that it was too vague or something, and
Yeah, I thought omitting it would be a good idea.
You're in favor of omitting? Sue, do you have a perspective?
I don't have an opinion on this matter, but thank you so much for asking.
Jason, I know you're new to us. Do you have any thoughts?
Not really. I mean, as someone who does have livestock, as we do have chickens on our property, it's just that I have had no problem ever since this was even brought up. So it's just I'm just waiting for it to go into effect.
Okay, love that, thank you. So I can understand how it is a little bit vague and it might be hard to create parameters for that. So I also am in favor of omitting D and just having it end at C, if everybody else is.
okay, so I'll remove that. And then on the form, livestock registration form, we wanted to add in the attestation that is fully written in the regulations. Under section 6, number 6. Well, section 6A, number 6. So in order to have that attestation show up, I put it in where it would chronologically come in after their name and type of animals and then attestation. It bumps it into a second page if I include that second sentence. And so I put it in small font so we could decide, do you want me to somehow just sort of cram it in there with regular font? Or do we really need it because it is in the regulations already, the last sentence? Go ahead and read it.
The part about vaccinations?
Yeah, documentation. So it seems a little awkward. It says documentation for vaccinations
you're
testing
saying.
is not required unless there's a health emergency that provides reasonable causes.
I'm okay with omitting it from the livestock registration form because it is already covered
In the regulations.
here. Yeah, so I think it's a duplication and unnecessary. And I like that this is one page and nice and neat, and I want to keep it that way so that it's more user-friendly.
Okay,
Does anyone else have any thoughts?
I agree with that.
Chris, you think that's fine? It's
Yeah,
already
that's fine.
covered.
Yeah, and, I mean, you could, like with our tobacco retailers, when they do their annual permit, it says on there that the health department has provided them with a copy of the local regulations. So we just make sure that anybody filling this out gets a copy of the regulations.
Can do
Right.
that. All right.
Solves the problem.
Yeah, this form, as its author, I just put it together just so that we knew what we were going to ask of people, and we can rearrange it and make it look like we can maybe do a fillable form for people who want to just do it online. But of course, the one missing link is having a health agent that would, would be in charge of collecting this information. So once this goes into effect, it will be at the ready for our next wonderful health agent.
I'm going to be problematic for a minute. Do we want to put that on here? But then it's
Yeah.
going to create the same thing. I kind of want to say, like, as part of the attestation, that they have reviewed the document.
Right, even above their signature, we should definitely say, I
Right.
have been provided with a copy of the regulations.
I agree.
Yeah,
I
I will
think, yes.
put it in.
I
I'll
think
put it
that
in.
covers our butts, too.
Yes.
Yeah, I like it. Thanks,
read
guys. Lisa?
So I'll omit that last sentence and I will put in the one on the bottom.
Yeah,
Okay.
I read and understand, and I have a copy
Thank
of
you.
the regs. Very
good
good.
thinking. Okay, so next time, guys, will probably be the last time that it's on the agenda, and I will make sure that I put to vote on it. Although it was kind of a good error that we did those two little tweaks.
Yep,
All right, so
well done.
add vote. Number 5 of our action items is the approval of requests for additional garbage and recycling containers. I see no one here presenting for those, so we will move forward. And on to number 6, which is the vote to approve meeting minutes from April 8th of 2026. Did anybody have a chance to review, and would you
Yes.
like to make a motion?
Can secretary make a motion for their own?
Yes, I did it all the time.
Oh, okay. I make a motion
You know
to,
they're perfect then, Lisa.
to accept the minutes for Wednesday, April 8th.
I am happy to second that. These are beautiful. Thank you, Lisa.
Excellent. All in favor?
Aye.
Any opposed? No. All in favor was unanimous. Magnificent. And then I'm going to pass the baton to Chris. Chris, it's your last
My last
report
report.
and announcements.
Yeah.
The last
so-
one here.
Yes.
I was gonna say, it's not the end of the road.
Yes, I'll be making many more, but last one here. And it's a doozy. I'm not going to read the inspections out loud because there's a lot of them.
Yeah.
So what I've been trying to do, under Massachusetts general law, food establishments are to be inspected twice a year, unless the Board of Health adopts a risk management system where, depending on the risk level of the restaurant, some can be 1 year. We do that a little bit, like places like the UCC, on here, the First Baptist Church, the Legion, not the VFW, I'm sorry, the Knights of Columbus, those are annuals. They're not a full-service food establishment, so we only do those annually, like Ellie's treats, also, they just do ice cream. I was actually going to ask the board to consider allowing KC Curbside Bistro and Mom on the Go to be once a year, because they're more of a commissary, they're not a sit-down restaurant. They have food trucks, the food trucks get inspected,
So it's kind of a duplication of services to have to do.
yeah,
it
and
twice
I
a
mean, they're
year?
running a kitchen there, they are doing cooking, but they're not serving food, it's not a full food establishment, so the risk level there is a lot lower than you would at a full-service place that's doing meals on the
Do
premises.
either of them have any former violations?
No, they actually inspected Mom on the Go today, out there on here, and they were fine, they had perfect score.
Amazing.
No violations.
And what was the other one you mentioned?
KC Curbside Bistro and, Ellie's Treats is currently manual, but they're both just commissaries, so. KC Curbside doesn't do any on-site food at all. Mom on the Go does have pickup, but they're not serving food there, so.
Do you feel comfortable?
I feel comfortable. I would suggest annually, but I would leave that decision to the board, especially since I'm not going to be here to inspect them again.
Just a clarification, if they're cooking and selling or delivering food, shouldn't they be under the same regulations as someone who's going to, instead of putting it in a box and handing it to you, bringing it to your table? Shouldn't it be like the same?
Well, it is. It's just, it's the risk level. So
Right.
when you're serving food on premises and you're doing cooking and cleaning and dishes are going back and forth, there's a lot more areas for contamination
Okay. All right.
and sanitation concerns.
Yeah, thanks for the clarification.
And again, it can be twice a year. I'm just throwing that out there.
I don't know, I'm on the fence.
Okay. So there's what I'm trying to do, some of these, so it's twice a year. The spreadsheet that I use to track inspections in the office, at the 6-month mark, it goes red, sort of a tickler to let you know you need to inspect these. It doesn't have to be every 6 months. You could do them within a week of each other. Technically, if you do a re-inspect, you could consider that your second inspection. I don't. A re-inspection's a re-inspection.
I like that.
So what I'm trying to do right now is make sure that as many as possible of any of the places being inspected have one inspection done for 2026. So some of these, they weren't at the 6-month mark yet, but I'm getting them out there. Either I'm hitting them or Alsco's hitting them. I did give Alsco a pretty substantial list because I do not have the time
No, I
to get to
know.
everybody.
I'm tying up a lot of loose ends.
Yeah, and as much as I've tried not to write any correction orders in the last 2 weeks, the universe has a different plan, so I'm getting pulled in a lot of directions right now. But at any rate, that's why there's so many inspections on here. We're just trying to make sure everybody's hit with at least one, and then that gives you a buffer, for the rest of the year until somebody comes in or Alsco's going out. However that's going to work, I don't know how it's going to work. So that's what's going on there. So those were done since the last meeting. No priority violations issued at this time, which is fantastic. Complaints that we've received, there's been a few. The only one I listed on here was a Washington Street complaint of a mattress in yard, because I had to write a correction order on that. So what I have done, generally with the correction order, unless it's an emergency situation, they have 30 days to correct. I've been forwarding a copy of all correction orders to the building inspector and the town manager, so that there's somebody
Good job.
that can keep track of that.
That was going to be my next question, is how are we going to follow up on all the things that are left open-ended? Can I pause for a second
Yeah.
and backtrack to the inspections? Remember there was the facility that we wanted you to go back and do the surprise re-inspection of?
Yep, that was your convenience store. I saw them today.
Okay.
Flying, perfect score.
Okay.
Everything has been
So it's
addressed.
resolved. Good
Yeah,
job.
only place that I looked at every single product on the shelf to make sure it was within date. They are.
Thank you.
Everything's clean. Mop was hung. Paper towels in the bathroom. So they're doing a good job.
That's an indication of what a good relationship you've built with these vendors over the years, that you go there and you don't just write them fines, and you educate and make suggestions, and it's really gratifying to hear that these folks that get re-inspected have stepped up and are doing it. So thank you.
Education works.
Yeah.
I try to do that. I had a housing complaint that I went out to do today. It was actually kind of an interesting situation in that I was made aware that one of the residents contracted Legionnaire's disease, because that's a reportable disease, and it came in through Maven. And unrelated to me reaching out to her to follow up on the Maven information, they made a housing complaint about mold in the apartment. So Legionnaire's disease is not transmitted by mold. The only thing that I could think of that might have caused them to get it in the house is either their air conditioner or their shower head. So I reached out proactively to the property owner, and he's replacing the shower head. We can't confirm that it's in there, but just to be on the safe side, we're getting that out. They don't have an air conditioning system. No way of knowing without a full, federal level investigation, CDC, where they got it. Person's doing better, they're in a hospital, but we were able to resolve the housing complaint without having to go and do a full inspection and stuff, and that was because I had a relationship with the property owner. So sometimes it works, sometimes it doesn't.
Didn't we also have some follow-up for Giardino's as well?
I think you did that.
Yeah,
They
they
did the
they
reinspection?
repaired the flip top.
Okay.
Remember, he
It's been
didn't
a
show
job.
up for the meeting?
Yeah, I do
Yeah.
remember that. And then I thought we said we were also going to do a surprise re-inspection for them too.
Yep, I think I can add them to Alsco's list. I've asked Linda to, so my email will be deactivated at 12:30 on Friday.
I do have a relationship with Osco and Linda, just so
Okay.
that you guys know.
The
Just as a backup.
The former health department has a Gmail address that we've used on occasion. So there's an Abington Health Department at gmail.com. I've asked Linda to forward all the reports to that because anybody,
To
whether.
Michael? And to the town manager?
Well, it's just a Gmail account. So whoever they have down in the office answering the phones can access that Gmail account and then forward that information to wherever it needs to go.
I think it needs to be going to the town manager in lieu of there being someone sitting at that desk for our interim period.
He's gonna get a whole list of,
Okay.
all the logins and
I
anything that he
think
might
that will
need.
put some fire under his.
Well, that would
seat
punctuate
to-
the circumstances.
Exactly. I want to make sure that the list isn't growing and that there's a constant reminder to get someone
In
available.
there to do that, yeah.
I wish it was you still.
And on, the other thing with that Gmail account, so because we used to have multiple people working in the health department, all of our spreadsheets, the ones that I use for tracking complaints and for inspections are on a G drive, so that anybody could access them. That's why it's on Gmail.
Yeah.
Makes it, anybody can go in and edit, that way you don't have multiple copies flying around. We know what happens when you have multiple drafts of something, so it avoids that. So that access will be to whoever is functioning in that position. And the town manager will, and building inspector will get a copy of those.
Okay.
Building commissioner. Last thing on my reports, I attended one last training for the town of Abington, personal safety training, just all about situational awareness, being aware of what's going on and how to keep yourself in the field.
Yeah.
Good to know for Rockland too, huh?
Yes, yes. I will be asking for a radio. One of the great things about Abington is I have a fire radio in the truck
Yeah.
and in the office, so if I'm out in the field and run into trouble, I've never had to use it, but I have a way of getting in touch without having to rely on a cell phone.
I have one thing before we go off of this subject.
Yes.
So I had a friend of mine today had needed some shops, and I thought that other people might, at the shops return things, that they go into the building department?
Yes.
Okay,
Yeah,
I just
or-
thought that would be,
Oh,
this would be a good
good
vehicle to
thinking.
convey that message.
Yeah,
Yes.
Yeah.
there's already a sign on the
So say
door,
it again, where are they going?
building department.
Building department.
Yeah, I already have a sign on the office window because when I'm not in the office,
Well, yes, and the person that was down here was very grateful that they saw the sign, but they don't have the best eyesight. They said, "Oh, I'm so glad that I saw it, but my eyesight's not so good." So I thought it was worth the moment.
Yeah,
I
absolutely.
thank you.
appreciate, yeah.
Yeah, no,
Nothing in
that's
this
a good announcement.
Yeah.
The building department.
Yes, yes, they are in this building. Yep. And fortunately, Melissa, who works in the building department, used to work in the health department, so she's familiar with the protocol and how to handle and what we can accept. So just a reminder to residents, if you're bringing in sharps, they need to be in a sharps container. If you are unable to obtain a red boxed sharps container, we will accept them in detergent bottles, the thick, heavy plastic. Milk containers, water things are not acceptable, even if it's your Wegovy pen. It's got to be in something that protects people.
So no coffee cans?
Yeah, I mean, the coffee cans I would think are okay,
I'm
but.
joking, but because we've had them bring it in that
Yep,
way.
yep. I've had people bring in loose needles and get
Well,
very upset with me when I won't
exactly,
take them, so.
No, no, you have to give them safely.
Yeah. All right, so that's it. That's the health agent report. Last few announcements from the health department. So first of all, I'll do the board's job and welcome Jason to the board as our newest member. He was elected and sworn in, so congratulations. Replacement totes, since this came up on your agenda. So not everybody might be aware that our contract with Boston Carting ends on June 30th, and we put the trash out to bid. The bidding was just closed on Monday, so those are in. We are unsure at this time who is going to end up getting the trash contract, and I will not be here to be involved in the final part of that process. As a result, for replacement totes, I'm down to about 15. I usually order, it's 150 minimum, and it costs about $12,000. So I have held off ordering new totes just on the off chance that if we get a new vendor, if they're not going to use our totes, I don't want to spend the town's limited funds
Yeah.
on something that we can't use. And I will not be here to rectify that once that decision's made. So for anybody that has a broken tote, number one, there's not going to be anybody to go out and replace it for you. We do maintain a list. If you call and somebody picks up the phone, we'll put you on a list. But I can't give a reasonable turnaround time for when that will be done. And we will, if I'm able to do any in the last 2 days, we'll probably run out of barrels. And we're just holding off until the decision on the trash vendor is made.
When do you think that will be?
I think it's May 15th is when the announcement's made. And then the new contractor would take over July 1st.
So who is in charge of making that decision? The Finance
The
committee?
Town manager is the procurement officer for the town of Abington, so he makes the ultimate decision. And I just helped to put together the request for proposals, and then we read through them. I don't know what I'm at liberty to discuss about that, so I'll just leave it at that, we've looked at the bids,
You
and
probably saw the feedback from our board that we had a really good rapport with Boston Karting, and I hope that gets taken into consideration. Hopefully.
on other subjects. So social media, the Board of Health, well, first it was the Health Department, now the Board of Health has a Facebook page. I am sunsetting that. You don't have anybody to take over it. I have had taken.
You started it.
I did.
I know.
I did. Yeah, way back when I was on the Board of Health.
So you
I
might as
started
well
it.
sunset it.
Yeah, it's going to post up till Saturday, then it goes dark. I want to thank everybody who's paid attention to it. We've had a pretty good following. I've been told by our social media person that behind the police department, the health department / Board of Health Facebook page has had one of the most activity. So appreciate everybody that checks us out and follows us.
You did a
But
really good job.
that will be going away. And we don't really have any other social media presence. The Facebook, the town website I'll update tomorrow with the new board configuration, and then remove myself as a health agent. And after that. So the last thing I'll say on that, again, and I think we've discussed this, I am not aware of any current concrete plan for replacing me. It's my understanding that somebody's going to be brought in full-time to answer the phones. My concern for that, and I wish to luck to anybody that has to sit and answer that phone. If you don't have answers or access to information or the ability to follow up on complaints, you're going to be dealing with some irate people. I love the residents of this town, but most often when they're reaching out to the health department, it's not their best day.
Right.
And the ability to provide information and be proactive in responding to their needs is important. Emergency inspections, I don't know what the process for that is going to be. Unfortunately for you guys, the health agent acts on your authority, so minus a health agent, it's you guys. It has been my pleasure and my honor to serve as your agent for the last almost 4 years. I am leaving Abington, not wishing to leave, but as we know, with our budget and where the town's going, it's really not sustainable for me to stay here. I had been undervalued by town management. We had a department of 3 people that really had an excellent level of service that we provided. One person can't do all that work, so we've had to cut back. And I get it, we're not the only department that faces that. But, you know, you have to be able to survive as well as provide for the town that you work for. So I wish Abington the best. I want to thank everybody here for their time and patience. And I look forward to seeing you in a new role. If you need something from the health department, talk to the town manager. And good luck.
Well, Chris, you're going to be so sorely missed, and I just so regret that I think, you know, your absence is going to be felt so profoundly once things start going awry.
I mean, everybody loved Marty, and then I came along, so you'll find somebody and forget who I was. It's all right. They still talk about Sharon to this day.
I'm still in touch with her.
Oh, are you? Yeah,
Is there anything posted to get candidates yet?
my understanding, and none of this is official or set in stone, is that their intention is to eventually post it, and they're looking to have somebody for July 1st, so fiscal year '27. So what happens in the meantime, let's just
Okay, so
hope
not
that
yet.
everything's cool.
Don't they usually post that on the MAHB?
Yep,
That's where it should go.
yep, and it should be on the town website.
Yeah,
It should be other
especially, you
places.
know, since we're talking about credentialized people and all. Yeah,
Yeah.
that would be the place to go.
Yep.
That's where they posted after Sharon left.
Yeah, and that's
But
how
they
I-
waited 9 months after she left, after she gave her notice.
Yeah,
So it's
Yeah.
not, it's nothing personal. I know the town has been like this with health agents forever.
yeah, I think we're undervalued, and I gave a 4-week notice with the intention of being here to bring somebody in and, you know, at least show somebody the ropes before I went, but Friday is my last day.
Didn't come to fruition.
No.
No.
Well,
we appreciate you.
we appreciate you. We have appreciated you. I've been on the board just for a year, and I learned a lot from you, and I really appreciate your capabilities and your sense of humor and your ability to cut through it all and do the job so well. So thank you.
Thank you. Appreciate it.
All right, we're going to move on to our final action item, which is correspondence and announcements. Does anybody have anything they would like to share?
Oh, I do. I have 3 things. Well, just 2. I think I'll just talk about 2. Take that one off. 4 of us are on Saturday going to take our nice spring Saturday and go to Danvers, Massachusetts, for the Massachusetts Association of Health Boards certification program training. That starts at 8 o'clock in the morning, finishes at 4 in the afternoon in Danvers.
a long day.
And they cover such exciting topics as, just so you know, legal authority of the boards of health, public records, open meeting laws, conflicts of interest. We'll really learn a lot more about SAFE 2.0 and workforce standards. We'll learn about best practice for advocacy and education, conducting hearings, public health and environmental protection, liability for Board of Health members and staff, and then what kind of health issues are coming up that the boards should be aware of. So we have a really intense agenda on Saturday, but on Sunday, we'll have a board that is going to be so knowledgeable and so on top of things. So that was my one thing. And my second thing is setting our meeting dates. Monday night, the select board decided that they would meet on the first and third Mondays at 6 p.m. And I want to put out a motion for us meeting on the second and fourth Mondays, once we get through May, so starting in June. The second and fourth Mondays at 5 p.m. Is what I am proposing, except for May, which would be our meeting on the 13th, the public
For the public
hearing.
hearing,
And
right.
then, and maybe the May 27th to tidy up any other things before we switch back to Mondays. I
I'm
don't
in
know if we have to
favor.
vote on it, but,
Do we need to officially vote on it? I think we can all just kind of agree.
yeah.
You can just agree.
I'm
yeah.
in favor of going back to Mondays, but changing the time to, or keeping it rather, to 5 o'clock. Is everybody else available as well?
It's gonna,
And I
how about
like-
in November? It gets dark so early.
So you said the second and fourth.
Yes. That way we don't
think-
overlap with select board.
Well,
and-
sometimes it's necessary, so, yeah, that's a good plan.
And if there's a Monday holiday, we decide whether we reschedule it to an alternate day or just not
Just
have
that
it,
one.
right? And then in the summer, has it been historically the
We
case?
dropped down to
Yeah,
once a
one
I was
month.
just gonna say, because this is picking up in June, so July and August would be right around the corner there.
So then we just do the second of every month?
Yeah,
Perfect.
For
well,
July and
no,
August.
wouldn't that be, the first 2 weeks in July are like the busiest vacation weeks?
Oh.
Do you want to do it the,
Quickly hand me my phone. Yeah, let's do it
Well-
out.
you want to do the 4th instead of the second week?
I don't know, I hesitate, I mean, it doesn't, like, I don't think our bylaws say that we go to one, and that's the end of it, because of what's happening with the transitions and the
Will
health
we need to
agent.
have?
Yeah, you can
We
choose to
might-
meet twice.
We might have very short meetings, but, and not everybody necessarily has to be here. I just
Yeah.
think there's so much that's gonna be happening in May and June, and when we get a new health agent, that we might need to just make this board connection.
I thought we always dropped it in July and August.
Well,
You just said May and June.
those are the months that we are probably definitely without a health agent. And July 1, we have perhaps a new one. And
Okay.
we might need a lot of time with our new one to just kind of get rolling with it. So I don't know. I don't know if we should like eliminate meetings during the summer unless, just in case, right? So keeping it on the 2nd and 4th, and if we don't have it, we don't.
Yeah, you can if you want.
Do we need to decide that now? Like, I think let's hold off
Yeah.
on making that decision.
Yeah, just don't forget, now that you don't have a health agent, to contact Nancy Hurst to,
Yeah.
and then
Will
your,
she post our agenda?
no, so that will need to go to the town clerk. And I would recommend emailing Leanne and Barbara both, just in case one of them's out, because it has to be posted, only required to be posted at Town Hall 2 business days prior to the meeting. So if you're meeting on Monday, it's the same as it used to be on Thursdays. And if you're meeting on Mondays, it means Ellen's going to have company. My new Board of Health meets on Wednesdays, so I'll be here on Mondays.
Oh, you're gonna come.
I am a resident of the Abington, so.
I love
Yeah,
that.
I was just saying, I don't think we should cancel meetings before, because we're gonna have a kind of a bumpy summer, I think.
I think so too, but I also think we're not gonna be able to do a lot of anything, and
Well,
I
I mean, what's a
want,
quorum, 3 people?
yeah, so we'll make it work.
Yeah.
So May 13 and 27,
It's for sure, at 5 o'clock on Wednesdays.
and then June 10 and 24.
Oh, still Wednesdays, okay.
Oh, sorry.
For June.
Sorry,
Yeah.
May, thank you. May 13 and 27, June 8 and 22.
And then we can just kind of
Play it by ear, but tentatively skip one, so 6 and 20. 13 and 27, thank you. Wait. 22. Oh, so there's just a longer gap for that because it's a longer month, is that why? 22.
The first
and then
Monday's on the
skip that
6th.
one.
that's one.
It wouldn't be 6, it's 13 and 27? Oh, okay, yep. Thank you. 7, and then August will be 10 and 24.
And if we cancel, we will.
And then we can decide, we'll see what's kind of on our plates.
Yeah.
What was
not that
July
I love
again?
meetings,
Sorry.
but, you
July
know.
is 13 and 27.
Would you like me to book the Buckley room on those dates for you as my
Yes.
parting gesture?
Would you be so kind?
I can do that.
Thank you, Chris.
Any bit
You're the
helps.
best. Oh my gosh, so I need
For
to make
5
sure that I create the agenda and get it to Leanne and Barbara 2 days beforehand to post. And
Yeah.
also, why am I also sending it to Nancy Hurst?
No, you're not. So if you, I'll take care of booking your rooms through August, but after that, if you're booking the rooms.
Then you book through,
yeah.
all right, rooms are through Nancy.
Rooms are through Nancy.
Leanne and Barbara.
Yeah, and if you're meeting on Mondays, just make sure Thursday by noon, you have it to
I'm gonna
them
do
to
it
post.
immediately after, so I don't forget. Everybody, I'm gonna take one and pass it down. This is Jasinia's business card, so we all have a copy so that we can be in touch because she was a fabulous resource.
Yes.
And then if everyone is agreeable, I will take a motion to adjourn.
I second that.
Do you want to make a motion?
Oh, make a motion to adjourn.
Okay, well, yeah, let's do it.
And then a second.
I second
Thank
that
you.
motion to adjourn.
Meeting adjourned.